And with that, I'd like to introduce our next speaker and our last speaker, who's closing us out today, Dr. Boie. And he is one of our emergency room physicians, and he's going to talk about high-risk wounds and give us, hopefully, some pearls to take away. Thanks.
All right. Well, thank you for that introduction, and thank you to you all. You've made it to the last 20 minutes of clinical reviews. We have a lot of ground to cover in that time. And so we're going to jump right in. I have no disclosures. Really, we're going to focus on two key areas here. One is best practices for laceration management. And then the second is looking at key clinical features and management of 4 high-risk wounds that you're going to commonly encounter in the ambulatory setting. And with that, you should be able to outline a rational approach for antibiotics and surgical consultation in those high-risk scenarios, and hopefully describe one new controversy or debunk one old myth for each entity discussed. So why is this important? Obviously, the patient comes first, and we really want our patients to have the best outcomes possible in these scenarios. We want them to get the highest quality and the highest value care. But secondly, these are not only high risk from a medical management standpoint, but high risk from a malpractice standpoint. So in emergency medicine, traumatic wounds only make up about 5% of ED visits, yet they account for 25% of malpractice litigation when you talk about minor wounds and traumatic injuries. So we need your participation here, and we're going to cover these 5 cases. And I think as we go through this pretest, what you're going to find is that you know a lot of this information already, and it will underscore that for you. But it will also allow you to focus on things as we work through the cases with which you're less familiar. So our first case, healthy 30-year-old male, presents with an uncomplicated finger laceration from a utility knife. So which intervention is most effective in reducing the likelihood of infection? Prophylactic antibiotics, irrigation, soaking, or use of sterile gloves? All right. Question 2. A 50-year-old diabetic male presents with a swollen erythematous index finger. He holds it in flexion and has pain on extension on palpation over the palmar aspect of the finger. What's the most appropriate management? Oral antibiotics and next-day recheck, sent to the ED for IV antibiotics, splinting and anti-inflammatories and next-day recheck, and sent to the ED finally sent to the ED for surgical evaluation.